Okay. All right. So we are recording this webinar today to provide this as a resource on our public website. Please be cognizant of sharing any personal or protected health information, either verbally or in the chat today, as like I said, this will be posted on our website. We will be posting this afterwards so that individuals that were not able to join us today, or folks just need to kind of go back through, you will be able to access this particular recording. So again, welcome to the Provider 2.11% Technical Assistance webinar that we are providing. Just as a little background, back in September, actually, we received approval from both the Joint Budget Committee and from the Centers for Medicare and Medicaid Services for the department's spending plan and how we're going to actually spend our ARPA dollars, otherwise known as the American Rescue Plan Act. The first project from that we actually rolled out was the rate increase, the 2.11% rate increase for providers that was actually backdated. So we received the approval in September and were able to roll this out, I believe, early November, late October. That allowed providers to know that you can actually receive an enhanced rate for a period of time, and then you just back bill and adjust your claims. We have received a lot of feedback that process is a little bit more complicated, and so we wanted to provide a step-by-step walkthrough of how you can adjust your claim back to the April 1st of 2021 timeline. So with that, I'm going to go ahead and pass it off to Kevin, who is going to share his screen and present to you a step-by-step process. For folks who are not actually actively asking a question, I ask that you go ahead and please put yourself on mute. If there is background noise, I'll just go ahead and mute you just to make sure we're good there. And there will be plenty of time for questions as we go through. Thank you so much. Go ahead, Kevin.
Hello, everybody. My name is Kevin Inarelli. Let me share my screen here. All right, can everybody see that? It looks like you can, yes. Welcome, everyone, to the Provider 2.11% billing webinar. Again, my name is Kevin Inarelli. I am a provider field representative. I mostly work with folks on the Western Slope, but I'm here to help you with your adjusting of your claims. So we have a quick agenda today, 3 topics. We're going to briefly go over the American Rescue Plan Act increase, and then we'll get into the meat of it, and then I'll show you some resources at the end. This was the communication that came out originally with the ARPA increase that laid out the 2.11%. Like Candace said, this came out November 1st, I believe. And it told you could backdate to April 1st of 2021. Originally, it said it would go through March 31st of 22, but that's since been updated. There's been a new memo. I'll show you that at the end of the presentation. But when this came out, it was said that only claims that were billed at a higher rate than the allowed amount and the 2.11% increase would be reprocessed. Providers needed to submit an adjustment with an adjusted bill amount for all other claims. So that's what we're going over today. That's the background, which leads us right into our next topic, which is how to adjust that claim. So first you need to log into the portal. Once you're there, you can hit under claims, you'll find search claims. And you just click on search claims. You'll get your claim search menu. You can search by your claim ID, which is the ICN number. You can do a date search range with member ID. There's a lot of different ways to do that search. Once you do that search, you'll get your claim number. If you looked it up by claim number, you'll only get that one specific claim. But if you do a date range, you'll see a few different claims. To make sure you have the right claim, you can click on the little plus button next to the claim ID, which will open up the claim amount and the details. So you know that you have the correct claim you want to work on. Once you have that claim, you just need to click on the claim ID in order to do your adjustments. Again, this is for all the claims you need to redo. It'll give you the claim detail again, make sure you have the right claim. And then at the bottom, you'll have some options once it's selected. Adjust, copy, void, reconsideration, or you can do a print of the claim. What you want to do is adjust the claim. So once you click on adjust, it'll bring you back into as if you're normally submitting a claim. You want to resume that claim submission using the standard process. It'll already be all laid out for you within the portal. All you need to do is change the billed amount. If you have issues with that, you can refer to the Submitting a Claim Provider Web Portal Quick Guide on the Quick Guides webpage. And I do have a link to that at the end. So I know I went through that fairly quickly, so I'm going to go through it just again from the beginning. Again, just log into the web portal as you normally would do. Under claims, you want to search for the claim that you want to rebill. You should have that claim number. If you do not, you just need to have the member ID and look at the dates of service that you want to rebill. Once you've completed that search, you'll get your results. You want to click on the plus button next to the claim ID to make sure you have the correct detail. Click on the claim ID to get into that claim, and then just resubmit with the adjust in their choices, and then increase the bill amount. Submit the claim as you normally would. Here's some resources for you. All the information I just showed you, you can find in the provider portal quick guides. Here's a link to that here, and or you can type that in. The newest HCPUF memo is the OM 22-010. You can find that information here. That's the one that outlines that this has been extended since to July 31st of 22 as of this point, that rate increase. And all that information can be found there. So at this point, does anybody have any questions?
Kevin, there's a couple of questions that have come in through the chat.
Right.
So if it's all right, what I will do is I will read those questions. And then of course, if folks want to ask any questions verbally, you're welcome to do that as well. So we'll start with the first one. Adjusting each claim one by one is so expensive to agencies that it would not reflect an actual 2.11% increase in a cost benefit analysis. Is this the only way? I can appreciate that statement. And unfortunately, because of the way the system is built, yes, that is the actually only way that this can happen. There is no way for us to do any sort of mass adjustment. The only way to adjust a claim higher is actually by manually going in and doing it. We are not able to do that on the back end or anything like that. I know there's been lots of an adjustment, and that's just not possible. The system will not allow us to do that.
So I'm going to respond. That was my question. In moving forward, if we have these changes, is there any way for the increases to not be retroactive? Like, could there be a 4.22 increase moving forward versus a retroactive one? Because we're not, I mean, I don't have the data, but we are not making a 2.11% increase on this. Based on,
can you identify yourself?
Yeah, my name is Karen Quirk and I work for Imagine. We're a community-centered board for Boulder and Broomfield counties.
Yep. Okay. Thank you, Karen. That's helpful. And so while that is absolutely the way we're hoping to go in the future, and no, that's one of the reasons why we were able to extend it. However, the way that the American Rescue Plan Act worked and the way that the additional funding came to the state had to do with a specific timeframe that started March 1st. That is a federal requirement. That is how the federal government rolled it out. And the only way for us to claim that money and to get that enhanced match is for claims that happened during that timeframe. So unfortunately, our hands were actually tied for that rate increase. But I do hear you, and that it was very difficult. That's one of the reasons why all of the other rate adjustments have been actually, think about the $15 an hour base wage. Those were all prospective because we did hear that feedback loud and clear and can absolutely appreciate that. And that is 100% our plan and our hope to be able to only do those going forward. So thank you for that feedback.
Thank you.
Absolutely. Okay.
This is Ann Patton. I have a question.
Sure. Go ahead, Ann.
So Kevin, in the example that you showed, there was just one charge. When I bill, I'm a small PASA. I just bill for my son. And so under the DD waiver, and I bill residential, supported community connections, supported employment, a number of things. Okay. So I have a number of things lined up. And I think where I have gotten messed up is that originally I thought I had to redo all of that whole claim and then make an adjustment in the one. And that's clearly not the point. And then I have a question. I realized after the fact when I was doing it that I could then just remove the other pieces that weren't relevant to the adjustments and just adjust the one. But I did have to put in all the information again. I couldn't just change the payment amount. It just didn't work.
So what you're saying is you billed for a lot of different services on one claim, and only one of them was getting the increases. Am I understanding that correctly?
Correct.
And then when you were in that claim, you were not able to change the billed amount?
You made it sound so easy. You just go in and change the amount, but you don't just change the amount. You have to redo the whole line.
Oh, I see what you're saying. So yeah, you have to put in the procedure code again.
Right.
It's
not like, oh, just change the amount and it's a fix. It's not that easy. But also what the situation I find myself in now is that because I had left all those other pieces in there while I adjusted the one amount, it totally screwed up my billing and what I'm getting paid. And I have another big question. Is there somebody in person that I can review the RA advices with? Because I can't make head or tails.
That's an issue a lot of people have, and I am happy to do here. Let me, where are you located at, Ann?
Denver.
So let me close this and share my screen still.
And another thing that I just noticed is when I started looking at, and then I'll let somebody else have a go at this. When I looked at the recent RAs compared to the old RAs, I'm getting charged copays.
So copays would be patient responsibility. It shouldn't be
for residential services.
I'd have to look at.
I've never been charged copays before.
I'd have to look at it. I'm going to put in the chat here because obviously we're going to need to have a deeper conversation. So
yeah. So well, Kevin, while you're pulling that up, and I appreciate that. And to Kevin's point, it sounds like we need to kind of dive in a little bit deeper into some of the issues that you're facing. But I really appreciate your willingness to speak up and so that we can kind of get this conversation rolling and kind of see how we can't specifically work with you to get some of these issues ironed out.
I would really appreciate it. Thank you.
So yeah, in the chat, I just put in, this is where you'll find all the field representatives like myself. We work by region. So when you have issues that can't be resolved by the call center that have escalated, which sounds like yours is, you can reach out to one of us on the field representatives. We can do things like go through your RA with you. We can troubleshoot your claims. We can look into why there's copays. There could be an issue in any number of places. It's just more complex than I can answer right now. So to get some hands-on one-on-one help, please refer to the field reps and we can definitely help you moving forward.
I will do that. Thank you very much.
You're very welcome.
Thank you, Kevin. And thank you, Ann. Again, really appreciate it. The next question that was in the chat, Kevin, is why does the system, it's from Amy, why does the system force me to re-enter the state and the provider ID?
Um, I don't work on the system side, so I don't know, but yeah, it does. It's just one of those quirks of the web portal that, and we all know who've worked in the portal, there are some quirks there, but it does, it has you re-enter the state and provider ID. Yeah, I can't speak to
why it does that. Okay. Thank you, Kevin. And then the next couple of questions are actually around the timing of the rate increase, so I'll take those. So both PETA and CS have asked about when those rate increases take effect. The rate increase actually was in effect as of March 1st, 2021. And so they were retroactive, which is part of the confusion and some of the issues is why folks have to go in and adjust their claim, because it was a rate increase that was backdated because it wasn't actually rolled out until November 1st. So to your answer, CS around, is it on top of the January 1st? So it was actually already in place prior to January 1st of 2022. And the additional rate increase that happened then for the $15 an hour base wage was on top of the 2.11. The 2.11% rate increase is scheduled to actually end July 31st, July 30th. I don't know how many days are in July. That's silly. At the end of July. And so you will see what is going to be the rate as of July will actually go down on effective August 1st by 2.11%. And that is strictly because of the funding that is available through ARPA, and it is time limited funding that we have available. Okay. What is the
Candace,
memo?
if I could speak to one thing, sorry.
Yes, of course, please.
We were talking earlier about the only way to get the rate increases to go into the portal, as I've demonstrated. You can do batch claims. You can use your clearinghouse to do batch claims, to do a bunch of reconsiderations at the same time. I just can't give you instructions on how to do that because it would be specific to your batch billing.
So that would be as opposed to the individualized one-by-one claim submission. Is that correct, Kevin?
Yes.
Okay, next, we have a lot of messages coming in, so forgive me, everybody, I'm going through them as quickly as possible. What is the memo number indicating the extension to rebill the 2.11%? I believe that's the link I put in there. I will get the number shortly.
It's OM22-010.
Thank you so much, Kevin. Thank you. And then Karen put in another comment, keeping track of state fee schedules has been challenging. Older versions are overwritten. Updates are different from page to page. Please speak to this. Yes, I appreciate that. Thank you. It is challenging. We have had more rate increases these past 2 years, year and a half than I have ever seen in my 10 years of working here. It is a lot. And so our rates team are doing their absolute best to make sure that the fee schedules are updated and correct. However, sometimes there's, rounding errors, or there's just things that just go wrong. And so they work very hard and quickly try to update them and get them corrected. And so they will adjust them as they find an error or realize that maybe a service got left off for an increase for whatever reason. I mean, these are massive, huge spreadsheets that they are working on. And so they do try to keep them updated and correct as quickly as possible. But I do understand that it is challenging to keep up with. 100% agree with you.
Okay, I'm going to speak to that actually, because I know that you guys are sending out memos all the time, and that what would be, and I just suspect that, you all have some sort of insular understanding of what's going on your level, and it might make sense to you all. But on the provider level, we can't know what the flip you're thinking about or what makes sense to you guys sometimes. So given there are so many memos and emails that come out, I feel there could be a little more kind of contextual introductory information about when something has changed, because we are feeling like we're seeing overwrites. We look at one thing one week, one fee schedule 1 week, it's looking different the next week, and now updates are not, like there might be a version like 1.2 But in 1.2, there might be an update on one page, and 1.4 might have a different update on another page.
Gotcha.
Like I used to kind of just look down to the bottom left and say, oh, this entire document was updated on this date.
Gotcha. Okay.
But that's not true anymore.
So let me ask you this. As the fee schedules are updated or changed, you're suggesting to put some sort of, maybe at the very top, kind of, hey, these 3 lines were changed, just to kind of let folks know where to look to?
Yeah, a few more specifics would be highly valued.
Okay, that's super helpful feedback. Thank you so much. I will certainly see what we can do to work on that. Okay. And then Timber says about the adjustments in the system past the year cutoff. If we use our clearinghouse instead of going through the portal, is it still true? We do add the adjustment code 7 on the CMS 1500 that is submitted. I don't, Kevin, do you know the answer to that one?
Let me see. About the adjustments in the system past. So you mean, are you talking about claims that are more than 365 days? Is that the question?
That's my guess.
Yeah, the timely billing.
So with the timely filing 365 days, that's one issue where you might want to start working with us field reps. We might have to do some things to look at that timely filing and see if we can make any changes. My advice would be get all caught up on ones that are still in timely, and then the ones that aren't, we'll start working on options. Again, a good resource would be me and my colleagues. I know that's a great answer, but you know, again, get caught up on all the ones that you can to make sure no more get out of timely.
Right.
And then we can start addressing the ones that are denying for out of timely and work with you and override.
Yeah, that's helpful, Kevin. And I think, you know, we are committed to making sure and supporting you all in receiving these rate adjustments. And so if you realize that you have some claims back to April of 2021 or May of 2021 that you're like, oh, now, you know, thanks for this webinar. Now it makes sense. We're happy to work with you as far as waiving the timely filing requirements specific to this increase.
Could I say something about Kevin's remarks about doing batch billing from
Sure.
the provider level? I mean, we've certainly tried to do that in order to not work claim by claim. But sometimes the state or I'm forgetting their name in this moment.
Gainwell,
thank you. Are denying things that we don't feel they should deny.
Do you have an example that's on the top of your head?
No, I'm not prepared with that in this moment, but it's definitely a trend.
That would be something I would definitely want to know, so we can fix the system. You know, our ultimate goal is to make it as easy as possible for you. I know this has been difficult with the rate increase, and again, like Candace said, the time frame we were dealing with is what we were dealing with. But if you
honestly,
can't batch claims in, that's a hardship to me.
It's been a difficult trend to follow because from our perspective, like one client will look similar to another, but the state will deny as a duplicate one client and not another when we try to collect the increase. And I'm sure we have issues on our own level. I don't doubt that in any way. But we're having a hard time isolating these trends and even knowing how to ask what questions, you know?
Yeah, I get it. I feel your frustrations. You know, the billing is difficult. It really is, and I recognize that. Again, this is something that maybe we can look at through the field reps. We can go in the system and maybe see that where that handshake information is happening between the clearinghouse and Gainwell, the EDI information. Maybe there's just something not being received right there, or, you know, maybe we can look at some things that are just wonky. And like you said, sometimes things are on the clearinghouse's side or your side, and sometimes they're on ours. So if we can identify where that is, maybe we can overcome some of these obstacles.
Yeah, that's been the challenge, exactly, Kevin, is identifying if it's on our side or on the clearinghouse side. That's been a big challenge for us.
Well, and I think, Karen, what would be helpful is much like what Kevin was saying to Anne, is if you could reach out to one of those field reps directly, then they can work with you individually and kind of walk through some of those claims to get an idea of where is there an error? Is it within the system itself? Is it, maybe the two numbers got transposed accidentally, who knows, right?
Sure. I mean, we might have been out of units for one client and not another, I understand there's just so many variables.
Right. But if you reach out to a field rep, they should be able to help you with that.
So how do we know, and maybe people on this call from my agency know exactly who we need to reach out to, but I don't. Like, how would I know, are there field reps designated to certain areas? How does that work?
Yep. Again, and I can re-put that in the chat. There's a website, and it's by region. So you just click on what county you're in.
Okay.
And then that'll get you right to your field rep.
Thank you.
And sometimes we share, sometimes things are really complex and we need to help each other. And so you might get more than one of us down the road, who knows?
Sure.
But start there.
More than one would be better than none.
Yeah. But I really feel like, when you do have the personal touch there, and we have, all right, well, this claim was, yeah, you're out of units, but these 5 others are all having the same issues. Let's dig deeper and find out what's going on. Is it the EDI? Is there something wrong with the system? So working together is where we get there.
Okay, thanks. It's been tricky. Thank you.
You're welcome.
What other questions do you all have?
I have a question.
Yes, and I see your name is Kayla. Kayla, can you do a quick little introduction so we know who we're speaking to?
Yes, I'm Kayla, and I actually am a new bookkeeper in an assisted living home, the Courtyard of Loveland.
Great, thank you.
And my boss, he has been saying for a few months that you guys are supposed to raise the Medicaid payment rates at the beginning of every year. And he actually doesn't want us to accept any more Medicaid members because InnovAge is paying more per member. And so I was wondering, is that correct? Are you guys supposed to be raising the rates?
No, there's no annual requirement as far as rates go around assisted livings. Perhaps your boss is referring to nursing facility rates, and those have a whole different set of requirements, but there is no annual requirement for rates around assisted livings. Okay.
And how do you guys determine the rates? Just kind of like the base pay, because it pays the like 1,000 more or something like that.
So we actually have a very, very complex rate system that we have an entire team dedicated to developing rates, and they put in a lot of different factors, from wages to space to, the cost of the service to the different services. So it's all of the different factors that they put in to calculate out what a rate is. And then from there, it is based off of how the legislature funds it. And so while a private pay may actually have a much higher rate because they are not beholden to any sort of public payments, and the legislature determines how much we can fund all of our different rates and all of our programs.
Okay, awesome. Thank you.
Yeah, you're welcome. What other questions do you all have? This has been very helpful. And I promise if you have the question, I'm sure somebody else does as well. So please don't be shy to speak up and let us know. Anybody?
I have a question. Can you hear me?
Yes, we can. Please go ahead.
Hi, I'm Peggy. I work with Community Link in Boulder.
Hey, Peggy.
And I don't know if anybody else had this issue, but I tried billing and I screwed it up so royally that now I don't know how to fix it. You can't, it doesn't seem to be something where you can adjust your adjustments. And when I've tried to void them, it takes the money takes all the money back, even the original payment. Is that something the field rep could help me try to unravel?
Absolutely. Yeah. Probably something happened within the RAs or just got real confusing or whatever, but yeah, they'll be able to get you back to square one and rebuild everything. I think
Okay.
it may take some time, but we'll definitely get you going for sure.
All right.
Great question. Thank you so much. Other questions for Kevin around billing. He is our claims guru. That's what I'm referring to him from now on.
It's overstating it.
Is this for CDOS participants? No, this is not for CDOS participants. So CDOS claims go through our fiscal management system or FMS vendors, and so it is completed differently. Other questions? What does it indicate if a claim number starts with 8?
Usually it's an adjustment. Well, I'll tell you exactly. I have a. Oh, so an 8-0 claim usually is a resubmission by someone at Gainwell.
Thank you, Kevin.
And no, they're through the portal. There really is no way to batch bill. I'm pretty sure.
So Amy asked if there was no batch billing through the portal, and that's what Kevin was answering. So then will they be giving the increases to CDOS? So Patricia, yes, CDOS actually did receive increases as well, but that all went through the FMS vendors. Please repeat your statement about the rate decrease in August. Of course. So thank you, Holly. So effective August 1st, the rates that are currently out there that are currently effective right now are going to go down. So that is the 2.11% rate increase that was authorized through the American Rescue Plan Act for our providers, continues through the end of July. So that 2.11% will go away effective August 1st. So the rates will go down on August 1st. Were they supposed to then give the employees increase? I'm confused. So Patricia, I think your questions are, of course, Holly, are a little bit more specific, and I'm happy to talk to you a little bit more offline around CDOS. What you can do is if you can send an email, we'll have somebody reach out to you. I'm going to put an email in the chat for you so that you can reach out and we can connect with you directly.
So this is Karen again, of course. And one of the other obstacles we've had is that when an increase or decrease, for that matter, comes into effect, is that the Gainwell isn't properly prepared for it. Right. So whether we have issues in our own system, we're trying to stay on top of things, but then sometimes Gainwell is not even yet prepared for the memo that came up from HCBS. So there are denials or EOBs that come out that say, oh, we made this change, but now you're being denied, but don't worry about it. It's kind of something we're trying to fix.
Kevin, do you have any information on that or any insights on that?
It was my understanding that, before those memos come out, that we would collaborate with Gainwell and make sure those system fixes were in place before the memo came out. But if that's not happening, that's something we would want to know. But do you have any specific examples by any chance?
I don't in front of me, but I certainly get the newsletters from Gainwell, and they report that, they were denying claims for reasons that basically says that they weren't prepared.
Well, again, on Gainwell's side, those are system issues that, again, they should be in place before changes are made. Maybe there was a mistake made in the implementation. That's the only thing I can think of. And then they'd have to work through some bugs. That happens with systems sometimes.
Well, that gets confusing for the provider, right? Because we don't always know, again, is this being denied on because of our user error or because of our system?
Yeah,
or because there's something going on at the state level. And so we're getting denials and we have to sort through them. Is this us? Is this something else?
You know, and I think that's another great example of, you know, utilize your field rep, because if you call the call center and they say, hey, this change is made, but this denial's correct, and they're conflicting information, that's something to bring to a field rep to say, hey, am I doing something wrong? Or is the system misbehaving? Because I'll tell you, there are times as field reps, we do find mistakes in the system on our end. So,
and us too, of course. That's why it's been so challenging, because there's issues on our end. There's challenges with HCBS, and there's challenges with Gainwell. And so it's a lot to cipher through to figure out how to, you know, work smart versus too hard.
Yeah. And I feel like, you know, have someone in your corner, right? Like, I mean, you know, have someone that you can reach out to. And again, you know, us field reps, we're not the call center. We can't do every single issue that comes up. We'd be inundated. But when you're having conflicting information, when you're having these more complex issues, yeah, we can be someone that's, hey, let's navigate this together. So you don't feel alone. You don't feel like, oh, I don't know which one's happening. We can identify it together.
So Kevin, I appreciate that. And I think that's a really important point, as the field reps are for more complex issues. They're not for everyday questions. And so I want to implore everybody to, if you have just basic questions, to continue to reach out to the call center for those for that information. But if you have a really complex issue with a claim submission, that's when you would utilize the field rep.
And so I would state as well, if you do call the call center and you're not getting the information you need, please get that reference number. For two reasons. One, when you come to the field rep, we have a place to start with that reference number. We can look at what's already been looked at, identified. And also, you know, if there's conflicting information, we can dig deeper into that. So it's just helpful for everybody.
Thank you, Kevin. Okay, so we want to go back to the chat. We have a couple questions that came in. So Amy asked, how is the 2.11% going down going to affect the rate changes occurring July 1st? Great question, because we want to talk about the complication of all the rates that are changing. So the Colorado legislature approved a 2% across the board rate increase for all of our providers. And so that will go into effect July 1st. And so essentially what that means, Amy, is that effective August 1st, your rate is going to go down by overall 0.11%. So it's the 2%. And then for the month of July, it'll be a 4.11% increase. And then for the month of August, it'll go back down to just a 2%. So there's going to be a higher rate for the month of July than there will be for the month of August. They're two separate increases, two separate funding streams, to be clear. But the 2% that went into effect on July 1st, that will remain. So they're two separate increases. We just combine it all into one rate, which I realize is super complicating. When will the August rates be available? That's a great question. They should be available because we're focusing on getting to the July 1 rates out first. And so my hope is those will be available here pretty quick within the next month. And glad to know about the field reps. Had no idea there was this option. I'm super glad that we were able to provide that information, and hopefully that is helpful for you in the future, Anne. Okay, what was the percentage again? So 2% for July 1. So that was through, and that is ongoing. That was through the General Assembly that just occurred, goes into effect July 1. On top of that is 2.11% that has been in effect since March 1st of 2021. So it's two separate, add them together equals 4.11, but it's two separate rate increases, 2% and 2.11%. The 2% stays, the 2.11% goes away. Clear as mud?
So you're saying that
You're welcome.
for the month of July, it's going to be 4.11, but then,
Correct.
then August 1st, it goes down to 2 point?
Correct. That is correct.
Okay.
The term limited funding that we have through ARPA will be ending for this particular project will be ending July 31st. And so that was the 2.11. Is that across the board, CDOS too? Yes, Janet, it is across the board and it does apply to CDOS as well. Other questions? We have about 3 minutes left. Any other questions from anybody? Okay, not seeing any. Kevin, you can probably, you don't have to share your screen anymore if you don't want. Oh, 2 questions had them come in. One, will you be including the PowerPoint to all of those participating? Yes, we can post the PowerPoint along with this recording. And 2, we're all waiting on the edge of our seat.
How about if I just unmute?
Perfect, I like it.
So the second question is, and this is part of my nativity probably here, but the 2.11%, did that ever come into play? Has that already been in some of our current billings, or is it always something that we've had to go back and do an adjustment for?
So that's a good question. So the only claims that you had to go back and adjust was before November 1st. After that, that was what the rate currently was posted and what the rate was. So you should not, unless you didn't, unless you build a different amount as a provider, you would not need to go in and adjust. If you build the amount that was accurate and was posted as the rate, then you would not need to go back and adjust those.
Great. Okay. So if I've done that, all I need to do is April 1 through October 31st.
Correct.
Okay. Thank you.
You're welcome. All right. We have another question is, there will be 2 different rate schedules released to reflect this, correct? Yes. So there will be one that will be effective for July 1, and then there will be another one that will be effective for August 1st, because the rates will be changing. Needless to say, we have been keeping the rates team very, very busy. Other questions in the last minute that we have here? When will those be released? That's a good question. Our rates team is working on them as quickly as they can. So they should be released as soon as possible. I don't have an exact date at this point in time. The July ones will be released anytime now, but the August ones will likely be released within another month. All right. So I'd like to take this opportunity to thank you all for joining us this afternoon. We really appreciate you taking the time to kind of jump on, ask questions. We're hopeful that this was helpful for you. We're hopeful that this can help you with some of the back billing. If you have some of those really complicated questions or claims issues that are happening, please reach out to the field reps, as Kevin mentioned. If you have a more specific that is related to the rates, specifically about the increase or decrease, or you have a specific service question, please reach out to that HCBS inbox, that questions inbox I posted in the chat earlier. And again, this will all be posted on our website as soon as we are able to. It will be on our website. All right. Well, thank you all again so much. And happy June, because somehow it is June 1st already. I hope you all have a wonderful, wonderful summer.
Thank you, everyone.
Thank you.